Hello, everyone, and welcome. Tonight's live is super special and exciting. We have a fire of a medical panel for you guys. And in case you did not see the title of this, we are talking medical grade liquid collagen tonight. So we have people from all over the medical industry just coming on, giving a little of their expertise and their opinions on the difference between your regular powdered collagen and the difference between, whether it's bovine or any of that good stuff. And so, hello, Miss Lauren. I see you on there. Thanks for hopping on. Here's what I want you guys to know. It's very important that as you're watching this tonight, or if you're watching the replay, let us know where you're watching from. But more importantly, how did you get here? Who showed you this? Did you see it shared somewhere? Did someone send it to you? What you want to do, if this is something that interests you, whether you want to know more about it, you want to purchase it, you need to get back with the person who introduced this live specifically with you, okay? And then also, if you have any questions, feel free to throw them in the comments. As I see them, as we're going through, I do not have a medical background, but I am going to be kind of the host of this to help people get their questions answered and just introduce these amazing speakers to you. But guys, if you have questions, throw them into the comments. And if we don't get them to them tonight live, we will try to come back and go through the comments and get them to you. More importantly, we know that referrals and spreading the information, especially on social media, is in the hands of our watchers. So everyone who is watching tonight, we will ask that you will hit the share button and share this with your network, because we believe that the information you're going to hear tonight is of value to every single human that you know, because here's what we do know. Every single one of us produces collagen naturally, but after the age of 25, that collagen production just starts to tank. And after a little research that I've done myself, I've realized that not only does our collagen tank, but a lot of us are not only just deficient in collagen, but almost completely depleted. And so you'll hear a little bit about that tonight. And without further ado, I want to introduce our first speaker. I'm going to invite Miss Julie Owens. She is a retired registered nurse, has an extensive background in the medical field, and I'm going to let her come on. She's going to give you a little bit more about her background and just talk about what liquid collagen means to her and the benefits that she believes make type 1 hydrolyzed medical collagen more important than anything you've ever heard of before. So Miss Julie, welcome, and take it away.
Thank you so much, Bree. Thanks for inviting me, and I'm honored to share how I feel about our type 1 collagen. So a little bit about my background. I have been a nurse since 1993. That's dating me a little bit, so you know I need my collagen. And anyway, I started in a med-surg area. Soon after that, went to cardiology, and then I spent 13 years doing home care, because it worked out great when you were raising little kids, because you could kind of run around and grab them when you needed to in the midst of your work day rather than being at the hospital all day. Anyway, I ended my career on a labor and delivery unit. And I injured my back on that unit, and that kind of led to me trying to look for something else to do. Anyway, so just knowing that, I have some spine issues. I've had a lot of aches and pains and problems with my joints as a result of having multiple surgeries. And I didn't even know that I needed this until I started using it. So I did do a little research on it. And what I did find out, and why I was so happy about our particular product, is that it's bovine sourced. And what I understand about that is that that's a good thing, because the collagen that is extracted from the bovine source, it more closely matches our own collagen that we used to make more abundantly in our body. So the molecular structure is recognized by the body, so that way we know what to do with it. So if your body doesn't recognize something, it doesn't know what to do with it. It almost even encapsulates it and gets rid of it and treats it as a foreign invader. But when the body recognizes it as something similar to what we're used to making, it's going to absorb it more readily. And guess what? We're going to start seeing things change, because I mean, at my age, I'm over 50. We're seeing sagging skin, we're seeing wrinkles, we're seeing aches and pains in our joints, we're seeing bone loss, we're seeing muscular loss. I just talked to a doctor today who said that part of the reason is some of the muscle, even in your face, you lose lean muscle as you age. And so every year after the age of 25, we lose 1% of our ability to make this type of collagen. So imagine by the time you get to be my age, you're very depleted, as Bree mentioned. So in my opinion, so I've been taking this product since last June. I've even done 1 month of collagen loading. And what I've noticed is lots of improvements in things like the sagging of my skin. One of my favorite things that I think it's helped me with is my hips. I had a lot of hip and joint aching and my low back, and I had a knee that always bothered me if I went up and down the stairs. I don't even feel that pain anymore. Now, I can't say or that it's proven that the collagen fixed all that stuff. But what I can say is that my own experience is that my symptoms are different than what they used to be. And from a medical standpoint, I feel like I understand why this product is superior to others. So I don't know. I'm never going to stop taking it myself. So
I
I think
love that. Thank you so much. Yeah, you're right. Like, I mean, the difference that you feel after especially taking it for as long as you have, and just knowing, again, just that medical background of knowing the difference in this liquid collagen and the way that it's absorbed in the body and the different rates is awesome. So thank you so much for popping on tonight. I appreciate you being here. One thing I want to ask you, can you explain a little bit about, and just real quickly, what you mean by collagen loading?
Oh, okay. So what we're doing is we're tripling the regular recommended dose, and we're doing that for 30 days. And that's essentially just to give your body a little boost, a head start to get things loaded up, just like it sounds. You're loading your body up with collagen, then you can return to the regular maintenance dose. But what you're going to see by doing that is an increase in your results. Because the girls that I did it with in a group of mine, we're posting pictures of their hair and their skin and their nails, of course, because those are things women like to see. But I was also hearing people that it's really helping with joint problems too. So that makes me really happy.
Yeah, absolutely. I will tell you, the results pictures, that they speak volumes, and they're completely mind blowing. But when you actually know the people who are posting them, you're like, oh my gosh, this is amazing. So
yes.
Awesome. Thanks for coming on and spending your time with us tonight, Julie. I really appreciate you. Thank you so much.
You're welcome.
All right. We won't take up any other time. We're going to move right into Miss Olivia. And Olivia is a cardiology nurse. And so if you will come on and just share with us what the liquid collagen means to you and your expertise.
Okay, awesome, Bree. Thanks so much for having me. I'm so excited to be here. So I have been a nurse for about 4.5 years now. Before I was a nurse, I was a CNA for about 6 years. So for those of you who don't know, a CNA entails a lot of lifting, and we have to use proper body mechanics as CNAs, and sometimes that just doesn't happen. So unfortunately, I had a back injury as a CNA, and for me, using type 1 medical grade collagen has really helped relieve those symptoms for me personally. So I have been loving using this. Also, growing up as a child, I have had extremely, extremely dry skin. My grandmother used to refer to me as being like a snake. So I shed all year round. I know that's really embarrassing, and I hate to share this, but growing up, I was very self-conscious about it. And it was just something I was very embarrassed about. So I am very excited to be using this product right now and helping with my extremely dry skin that I have suffered with for years. I've finally found like an answer to my prayers. So that was something huge for me personally. Another thing that I love about this collagen, the liquid collagen, it works so fast and absorbs so fast in your body compared to powdered collagen. So those amino acids are broken down more quickly and just help your body use it faster. So another thing that I really liked, as I'm also a new mom, sorry, I'm very nervous right now, so I'm a little scatterbrained, but I'm a mom of a 1.5-year-old boy. So, all of those new body changes have happened to me over the past year and a half. So postpartum, hair loss or stretch marks. So the collagen has really helped me with those types of changes that I've been experiencing. So I'm very excited to continue to use this new product. And I think that's it for me. Thank you so much.
Awesome. Thank you so much. Yes. And I think that that is a great little piece that you put in there. That, new moms, our bodies change after we carry those children. But you know what? Also, while you were pregnant, the type 1 collagen helps with supporting the child in there. So it helps with your muscles. It just helps with all of that good stuff. So I do get those questions a lot. So that was a good thing to throw in there too. But also with the stretch marks, it helps to hopefully reduce not only the appearance of them, but them happening whenever you have that extra collagen in your system. So thank you so much, Olivia. We appreciate you for coming on. I love that you shared kind of your history in the medical field and appreciate your time. So thank you so much. Before we move on, we're going to move to Miss Brandy here in just a second. But before we do that, if you guys will put in the comments from what you've heard so far, what is standing out? A lot of people think of collagen as hair, skin, and nails. I think something that you've heard today is that it's way more than that. And we'll dive a little deeper here in a little bit, but it's more than just that. It is all over whole body health. And Olivia talked a little bit about the amino acids and the benefits of those in your body. And I think that is super important too. So tell us in the comments what you would be looking for in collagen. What are you looking to improve? Is it hair, skin, nails? Is it joints? Is it ligaments? Is it cellulite? What is it? Put it in the comments and let us know what you're looking for. And don't forget, everyone needs to hear the information you're going to be hearing tonight. So don't forget to click the share button as you're watching. And thanks everyone who has logged on this far. All right, next up, Miss Brandy, if you will come on. Brandy is a diagnostic sonographer. It's a mouthful to say, but I can imagine the schoolwork and all the things going into becoming one. So Brandy, if you'll come on and just share with us a little bit about your background and your experience with type 1 liquid collagen, and also what you believe are the best benefits that you can get out of it.
I would be happy to. Thank you, Bree, for having me on. So my name is Brandy, and I have been a sonographer I guess it's been a few years now. I've actually worked at the same hospital for 21 years and decided to go back to school to do what I always have wanted to do. And I don't just look at babies. I think everybody thinks of sonography as babies, and that's not what I do. I do more diagnostics. I'm looking at more of the organs, and we do a lot of other things that people wouldn't even imagine ultrasound can do, procedures and stuff. So I love it. And I will mention, my husband also works at the hospital, and he is a pharmacist. So it's been really interesting to kind of introduce some of these products into the household with a pharmacist in the house. And the best part is when I see him sneaking the stuff, trying to try it all out for himself, which is awesome. And then I just wanted to, start with, I think our type 1 collagen, the medical grade type 1 collagen, it's really amazing how it just works from the inside out. And I think like Bree just mentioned a minute ago, we all think of the hair, the skin, the nails, and really it's about, from the inside out. And I personally have a lot of gut issues. I have a lot of digestive issues. So I'm really looking to see what this does for me as far as the digestion and things. Something else that stands out to me with this collagen is that it's a hydrolyzed collagen, which means that it's going to help absorption. It's going to help everything just work a little faster. Our bodies don't have to work quite as hard to get the benefits from it. That really stands out. The amino acids that are in this collagen, the list is incredible of all the benefits. And like I said, it's things going deep within the body, not just things that you're going to see on the outside. What else do I want to say? Gosh, it's just the absorption rate with this is incredible compared to like a powder or like a pill that you could take. So I will say I've done some research on that part. Even some of the other liquid collagens out there, they have a lot of additives. I'm finding a lot of added sugars and flavorings. yeah, ours might not taste stellar, but you know what? It's going to be worth it in the end. It's good. You're going to get more of the benefit from it. So I'm hoping again to get some gut relief from it. And then of course the cellulite and, all the things that go with that too. And the hair, the hair and stuff. So
Yeah. Well, you said 21 years in
20 years.
Okay, y'all, the collagen's already working for her because she doesn't look like she's old enough to be in the hospital for 21 years. So we're just going to say, anyway, we're going to end it here. No, I'm just kidding. Proof is in the pudding. No, I'm just kidding. But you touched on something that we haven't touched on yet, which is super important and is about the gut health. So it helps your digestive system. It helps support it. It helps from inflammation and all of that good stuff in your body. So thank you for touching on that because that is super important. Again, I appreciate you. We respect you for your expertise in the medical field and appreciate your time for hopping on tonight. So thank you, Brandy. All right, everybody. Next up is Dr. Bretz, and I want to tell you, Dr. Bretz, he is a chiropractor, and I will let him share with you where his practice is, just in case anyone in his area needs a new chiropractor, needs to get out there and get adjusted. But I also want you to know that Dr. Bretz carries specific type 1 medical grade liquid collagen in his practice. So if you're looking for it again and you're in this area and was shared with you through this, then I want you to feel free to reach out. So Dr. Bretz, if you will come on and just share with us, your opinion on type 1 medical grade collagen and a little bit more about yourself and your background. Come on and take the stage. Let me make sure you get unmuted. There you go. Welcome.
Absolutely. Thank you so much, Bree. I'm so happy to be here. This product has really lit a fire under me. And this went from like my 3rd favorite product in the line to now my number 1. After you asked me to do this presentation, like I reviewed and I put in 3-4 hours into this, and I'm going to be honest. When I started looking at this stuff, I just felt like, wow, I've been missing something. And I want to share this with people because my profession is based on how structure affects function in the body. And when structure, amino acids, proteins, when somebody's not feeding themselves properly or they're not getting the correct nutrients, it's actually going to jeopardize their body's ability to express life through it. And structure is built on amino acids. This collagen, and like I said, I'm embarrassed to a certain point because I've been a nutritionalist. I've been a chiropractor. I started adjusting people right from the get-go. I'm like, why are these people not responding in certain ways? Like majority of the people do, but I started getting into nutrition and then I went to nutritional healing classes. And I've come to find out that if the soil isn't ready to receive, or you're not feeding the body or the soil or the cells, tissues, organs, and systems of the body correctly to thrive, and if you're just eating just to survive and not to thrive, you're going to be missing gaps, and that is going to show up, and it's going to not allow you to have the structural integrity of your cells and tissues and organs and systems of your body. I'm going to actually make a statement, and it's my professional opinion, but the quality of our lives is determined by the quality of our cells, tissues, and organs and systems and the structure that they are. And collagen, it fills in these gaps and it creates structure. Not only are we doing this for our skin, which is 90% of our, or 70% of our skin is made up of collagen, but collagen is also in our bones and our connective tissue. It also is in our clotting factors for blood, our muscles, our fibrous tissue, our teeth, our cornea, our eyes, everything like that. So this isn't just about, this is the integrity of our cells. And when the integrity of our cells is high, and like we've already mentioned it, after 25, the quality of our cells is just, as we age, things just decrease. Our eyesight and all of these other cell functions, they decrease with age, correct? And what I'm starting to talk is that collagen fills the gaps in and creates structure, to be erect, to move, to twist, being subtle, being able to be flexible and graceful in our movements. And that's what collagen is honestly about. And if we know that we have a debt in our nutritional component. And we know for an absolute fact that every American is not getting enough collagen. So we need to, like I said, with the loading, we got to load people on this and get that debt paid off, and then just kind of maintain it. Every chiropractor, every medical professional, in my opinion, after doing this studies and actually praying about it, we don't have success in life. We don't have success in life if we lack knowledge. And this is a big component of having the best life possible. I also like to talk about structure. When you have high quality structure in your cells, in your tissues, and your organs, and all of these things, you're going to create greater function to flow through there, right? If we eat McDonald's every single day, that is what our cells and our tissues and organs are going to be being made up in the next generation. So the quality of what we put into our body and the absorbability of this is just absolutely mind-blowing, okay? So honestly, this has been only on my radar for about 3-4 months. I'm confessing. And it's almost like this epiphany, like, wow, this is a major gap filler. It stands in that area for us to fill in. It's like a glue, and it helps us to regenerate things, our tissues, our systems, our organs, our structure, our spine, our ligaments, our tendons, our teeth, our skin, everything. And to be honest with you, what really happened was that I was using another collagen, a powder, right? And every time that I would take it, I was getting an upset stomach, and it's just like, I'm very in tune with my body. And I just kind of felt like, you know what? I just quit taking it. Okay. And I never put these 2 and 2 together, but I was looking at myself in the mirror about a month ago, right? And before I actually started really loading on this, and I was getting this huge double chin. I mean, it was really torquing me off. And like, I was getting very self-conscious about it. I was actually going to go talk to somebody about doing something to tighten this up or tone it, right? And literally 2 weeks into using this product, this is almost completely 100% gone. It was like flapping, like almost like a chicken or whatever, you know? And I just want to really just talk to people, and I'm going to start integrating this into my report of findings. If you've ever been to a chiropractor, they give you what's called a report of findings, where you talk about what the problem is, can we help, how long it's going to take, how much it's going to cost. And this is actually I actually told Liz we need to keep this in stock all the time, because this is the lattice. Our bodies are made up. 70% of the proteins in your body are collagen. And I can't get the results from my healing or my work if I don't have tissue or soil that will absorb this and take it in, because structure and function go together. I believe that is all. Now, how does this, obviously age, right? But stress and all of these things help break this down, break our collagen down. I even believe that it can fill in the gaps with cellulite. Again, that's my opinion. Okay. I don't have the research or anything like that, but this really makes up the lattice of our bodies. Protein makes up the structure of our bodies. And if we lack it, we need to load back on this so that we can stay structured and have more function in our bodies.
One question I have for you. So whenever, well, actually, I'm going to have 2 questions, but the first one being, whenever it comes to the benefits that your patients will see, what do you think is the biggest benefit? Is it going to be pain relief, or is it just going to be results from what they're coming to you already for, magnifying those? What do you think is the greatest benefit for your patients specifically?
So when your body, so I've been touching spines for literally 20 years, and there's a tone about somebody's body when you can tell if they're nutritionally deficient, and all the, it's just after a certain, 10 years, it's just, you just start getting more communication with your hands. And the benefits of this is that when you don't have enough collagen, your body is going to be constricted and tight. Okay. And I believe when you start using this and actually paying off the debt and filling in the gaps and creating greater structure, the body is going to kind of release a little bit, and actually we can get greater work done. Okay. I know the power of chiropractic, but I know there's limitations when somebody's not feeding themselves well, and in quality of product. like I told you, the other products that I had tried with Collagen, I still had that chin, okay? And it was upsetting my stomach. And I can test a supplement. I believe I have a gift for just tasting something. And I knew right away when I took this product, I could feel the absorption. Like, I believe somebody else talked about the absorption. It's just, I can feel it, like almost like paying my debt off in my body almost. It's like, it's so absorbable. And like I said, the other product, I put it to the side. I actually had probably almost given up on Collagen until this came along. I think it's absolutely one of the most phenomenal products that I've had probably in the past 2 or 3 years, to be honest with you.
Wow. And I said that I was only going to do 2 questions, but another one came to mind because you do have a nutrition background as well, that you've studied kind of in depth in nutrition. Just give us a little bit about your studies in nutrition, kind of the expertise side of that.
So I've read a lot of books. I went to a lot of nutritional trainings talking about how diet affects the teeth, talking about like Weston A. Price, westonaprice.org is a very awesome website that talks about nutritional facts, factoids. There's no, they try not to have any skewing just try to keep it factual and scientific. And a couple of the books that I read there talked about how some of the founders of some of other whole food companies started to notice that they were actually dentists. Okay. And these dentists started noticing, okay, why are these 2 twins coming in? Why is one teeth rotten and the other one's not? So our diet and what we put into our body really drastically affects the functional expression of us as human beings in our life in every area, physically, mentally, emotionally, spiritually, everything. And when we are feeding our bodies well and we feel good, we radiate out good and we get good back. So it's just this constant, you know what I'm saying? When you don't feel good and you're not feeding your body correctly, you just approach life in a different way. Kind of, I mean, I would say almost in like a somewhat defeated posture, right? And when when you feel good and you're eating well and you're feeding your body correctly, it just completely changes your outlook mentally, physically, emotionally.
Yeah. Okay. Well, and it's funny because everything that you're saying, I'm going, it's all like, oh, that makes sense. That makes sense. That makes sense. I've gone to a chiropractor for years, and one of the things they do is either like a little massage before, or they do the stems. What is it? The TENS unit kind of thing.
Oh yeah. Yeah.
Loosen you up so that you can get the best results from your session. And so you saying that about the collagen in our body, how that will kind of help that process as we go. Okay, go ahead. I see you got another thing there. Go ahead.
So also during research, naturally to help the enhancement, obviously with the collagen is the other product that we're taking here, right? The seed. That helps tremendously with the process of absorption. It's not something that you have to get. Your collagen is still going to be 100% absorbable. They've designed this correctly. I'm just saying, helping with the process naturally, this product too. And also the cocoa. In my research also too, cocoa helps with the absorption and helps with the amino acids that help build the lattice and the structure and the function of cells.
Oh, okay. I did not know that.
So
now
we got this product too that can support. So this is obviously what we want is the main go-to, but this helps with the natural. And then we integrate in some of the cocoa with it too. So I like to drink the mochas, and that's helping build that lattice and help providing amino acids that help empower our body to help with the cell structure.
I love that. Awesome. Well, I appreciate your time. I know that a lot of people, I'm looking at the comments going, wow, this is amazing, and tagging everybody in there. Feel free to tag all of your friends, guys. Dr. Bretz, I appreciate your time. I know it's super valuable. Everyone on here, Brandy, Julie, Olivia, I appreciate you guys so much for spending some time with us. Again, guys, however you got to this live or to the replay, I want you to get back with them if you have any questions, or if you are if interested in getting on, loading, or just even the daily recommended dose of your liquid medical grade type 1 collagen. And we will be doing these more. Oh, I don't know how often, but we're going to be doing them again. I promise you guys, because the information is invaluable that you will get from these medical professionals. So thank you, everyone who came on and spent some time with us. Thank you guys for your time. I love you guys, and good night for now, everybody. Bye, everyone. Thank you.
Thank you.